we keep hearing that this thing is very hard to transmit. It's hard to get, right? And yet there's no treatment for it. Well, there's a lot of concern about this. What do you make of the scenario happening in Atlanta and in Nebraska?
This seems to be by the book. This is what you want to do with these high-risk individuals who are all on that ship, who are all exposed, that they're being taken care of kind of at state-of-the-art, top-line places that are able to deal with high-consequence infectious disease. These are places that have dealt with Ebola patients before, and that's a couple of notches higher than Hantavirus. So everything seems to be going according to plan. I think we have to anticipate some more patients might test positive, and I think we shouldn't be alarmed by that. That's what we expect. That's why we're doing what we're doing. And I think that this is something that will be contained just based on the biology of this virus. Even though it's spreading from person to person on that ship, it's something that's still not casually given to people. It's not like measles. It's not like COVID.
Yeah, it's interesting. We have the CDC acting director who's talking about the possibility of having these people who are in Nebraska spend the entire 42 days there. And I'll get your take. Watch.
There's going to be an individualized decision plan for them to determine if it makes more sense for them to complete their 42-day monitoring period at home. And there's going to be a couple of things that go into that decision. First and foremost, do they remain symptom-free? But then also, do they have all the structures and support to be able to continue that period at home, making sure that they can be able to isolate in a separate part of structure from anybody else, make sure that they can contact their health department, get tested if necessary if they develop symptoms, or if they need a higher level of medical care, that's available to them.
Would you prefer it if all 42 were being monitored in kind of the same atmosphere for the entire 6 weeks?
Not necessarily. It all depends upon the circumstances, just like you heard. So if a person can isolate in their home, away from other people, if they have a robust health department that can check on them, if they're close to a hospital that has full services available, including full ICU capacity, I think that's a legitimate way to go about it. If none of those criteria are met or one of them isn't met, then I think it might make more sense to keep them in Emory or at Nebraska. Remember, we did this during Ebola in 2014. A lot of healthcare workers returned from West Africa and they were monitored at home, and that went off pretty well. So this isn't unprecedented, but I think we want to make sure that the places that they go, they actually have the resources to stay safe and be linked to care.